This is my last and final speech, my persuasive speech. Velma Howard, age 76, was suffering from amyotrophic lateral sclerosis, otherwise known as ALS or Lou Gehrig's disease. This neurological disease left her with the deteriorating function of both of her limbs and would eventually cause her to lose the function of swallowing, giving her the danger of choking on her own saliva. She was already suffering a great amount of pain and knew her life would eventually come to an end. To prevent herself from suffering the greater amount of pain that was to come, she decided on assisted suicide with the help of her husband and 2 sons. Velma died a calm, peaceful death with the assistance of narcotics made available to her by her family. This type of situation leaves people with one question: should we legalize assisted suicide? I've done a lot of research on the topic lately and have formed my own opinion on the issue that we should legalize physician-assisted suicide as an option. To learn more about the issue so that you all can form your own opinion, you must know what assisted suicide is, the reasons why people support keeping it illegal, the reasons why people want it legal, and the guidelines that would have to be followed if it were to become legal. First, I will begin with a clear definition of what assisted suicide is. According to the article, Euthanasia and Assisted Suicide by Wesley Smith, assisted suicide occurs when one person gives the instruction, means, or capability to bring about an end of suffering. There are 2 ways it can be done. One way is by having a licensed physician write a terminally ill patient a prescription for medication that they can ingest themselves to end their life, which is known as physician-assisted suicide. This is the method that people want legal and is currently legalized in some states of the U.S. The other way is through euthanasia, which consists of physicians injecting ill patients with a lethal dose of a drug that would calmly end their lives. Both ways benefit terminally ill patients who are suffering from unbearable pain. Next, I will talk about the reasons why people support keeping it illegal. Assisted suicide has been an ongoing battle for many years, and there have been many attempts to pass bills to legalize the issue. According to the Patients' Rights Council, between January 1994 and March 2011, there are 122 legislative proposals in 25 states. All bills were either defeated, tabled for session, withdrawn by sponsors, or languished with no action taken. There are many different reasons why people want to keep it illegal. One big reason is that people think it would violate a licensed doctor's Hippocratic Oath. A Hippocratic Oath is an oath that licensed physicians must sign in which they swear they will treat ill patients, do no harm to families, or provide trust to families and do no harm. According to Michael North, a member of the National Library of Medicine, the Hippocratic Oath states that doctors must also abide to this statement: I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan. People believe that letting assisted suicide become legal would go against that Hippocratic Oath that physicians swear to abide and defeat the purpose of what doctors are supposed to do, which is to treat them by doing no harm. The article Should an Incurably Ill Patient Be Able to Commit Physician-Assisted Suicide by Joe Messerly gives pros and cons to the issue and states that another con to why people want it to another reason why it wants to be illegal is that it would prompt patients to give up early on life and not give recovery or miracles a chance. People might want to live their life early before it gets worse and give up valuable time that could be spent with their families. Opposers also believe that insurance companies will put pressure on doctors to end terminally ill patients' lives so that they can cut costs and keep insurance premiums down. They also think that family members will put pressure on their sick family members so that they can receive certain valuables that would be left to them in the will if they were to die. Religious opposers say that God is the person to bring people into life and that he should be the one to take it. They believe that God has a plan for everyone, and that includes making people suffering from agonizing pain. States are opposed to legalizing assisted suicide because any person who aids another person with suicide is voluntarily committing a crime and is guilty of murder. They see physician-assisted suicide, otherwise known as PAS, as killing other people, even if the patients are choosing to end their lives themselves. All of these points may be valid, but do they consider what the patient is thinking and how they are feeling? No, I think not. Now the reasons why physician-assisted suicide should become legal. The first reason is that people who are suffering from a terminal disease should be able to choose whether or not they want to die in a dignified manner using the constitutional rights of their own privacy and freedom of speech. People have the right to do what they want with their body, especially if they are suffering from a great amount of pain from a terminal disease that will eventually cause their life to end. It is not fair to make people live through agonizing pain if they would rather choose to end their lives. Another reason stated in Messer Lee's article is that it would give patients the time to say their goodbyes and lessen the pain and anguish on the families who live day to day not knowing when their loved one is going to die. Most family members don't like to watch their loved ones suffer, and having PAS as an option for those suffering from a terminal disease would let family members watch their loved ones go in a peaceful way before they begin to suffer more and give them time to say their goodbyes. The next reason is that many vital organs could be saved for organ donation to give to patients that can live after receiving a new organ. According to Messer Lee's article, PAS allows physicians to preserve vital organs that could be donated to those waiting on a donor's list if the terminal patient is an organ donor. If the disease is allowed to progress through its full course and unexpected death occurs, the organs may cease to function into where they are unable to be used. If PAS were legal, organ donation is something positive that can come from those dying patients who are unfortunately dying from an incurable illness by saving someone who is continuing to live their life with the new organ. Another reason is that the act of suicide itself is legal and not a crime. PAS is the same action as suicide, except that licensed physicians are giving terminally ill patients the help they need to end their lives in a calm manner. The last reason is that it could easily be controlled by clearly set laws that would prevent abuse of the method and at the same time protect the value of human life. PAS would only be there as an option for those who want to use it if dying from a terminal illness. If legalized, each state could set certain guidelines on what needs to be followed before the act of PAS could be done, which leads me to my next point of those guidelines that would have to be followed if it were legalized. If legalized, there would have to be many laws set to prevent the abuse of the method and protect the value of human life. Unlike Velma Howard, who was assisted by her family, the only act of assisted suicide that would be legal is physician-assisted suicide, in which the physician prescribes a medication for the patient to ingest themselves. The other type of suicide, euthanasia, would not be legalized and would continue to be illegal in the U.S. Currently, there are only 3 states in the United States that allow physician-assisted suicide. Those are Oregon, Montana, and Washington. As for Oregon's Death with Dignity Act, those laws have been effective for the state since 1997. These laws would be similar to the laws that would have to be set if PAS was legalized throughout the U.S. Before the act could be done, patients must be at least 18 years old and fill out a request form saying that they would want to end their lives in a dignified manner because they are suffering from a terminal disease. A terminal disease is defined in Tabor's Medical Dictionary as a fatal final illness in which recovery is not expected. Some examples include cancers such as lung or pancreatic, AIDS, ALS, pulmonary fibrosis, and many others. The doctor must diagnose the patient as dying from a terminal illness that would end their life within 6 months. The request form must be signed, dated, and witnessed by at least 2 witnesses, with one of them not being a friend, relative, or doctor of the patient. The doctor must verify the patient is making a voluntary informed decision and report the incident to the state's health department so that they are aware that the assistance will be happening. There must be a no less than 15-day waiting period after the first request in which the patient must verbalize a second time to the physician that they for sure want to end their life. After making the final decision of using PAS, the physician may then give them prescribed medications to the patient for them to ingest at whenever and however they want to. Within 10 days of the patient's ingestion of the medication, the doctor must fill out the Death with Dignity Act with the patient's info and send all required documentation to the state's health department. In conclusion, PAS should be legalized as an option for patients who are terminally ill and are suffering a severe amount of pain from a disease. If it were legalized, there would be set laws just like the ones I mentioned to ensure the method is not abused. People should have the right to decide whether or not they want to die in a dignified manner, especially if they are suffering from a terminal disease that is eventually going to cause their life to end. It is not fair to make them suffer if there is an option available for them to end their lives in a calm manner with the help of a physician. As a member of the healthcare team and a future nurse, I have experienced the situation of working with patients who are in extreme pain and wish to die so that they don't have to suffer anymore. It is heartbreaking to see their faces suffer in pain, and also their families' faces as they have to sit there and watch. Every individual should have the right to end their life in a dignified manner if they are experiencing a terminal disease. We all have our own lives, and whatever we choose to do with those lives has no effect on anyone else's. Thank you for my listening.
I'm itching. That you go tomorrow.
She didn't shorten much.